One of the most dynamic and exciting additions to downtown Tampa in the last year is something called Camls. It's a multi-million-dollar medical learning and simulation center, and it gives doctors and nurses, medics, all those in the healthcare profession, a chance to learn how to do it right before they perform procedures on actual patients. It is a proud achievement for USF Health and promises to have a huge impact on the Tampa Bay economy. In fact, it's already doing so. Joining us today to tell us all about it, Dr. Klasko. He's the CEO of USF Health. He is the Dean of the USF Health Morsani College of Medicine. And Dr. Laura Habner, right? When I get that right, Habner is Associate Professor of Pediatrics at the USF Morsani College of Medicine. And we're just glad to have both of you here about talking about this, because it's kind of the buzz in Tampa that Camls is here. So what does it stand for?
Well, it stands for the Center for Advanced Medical Learning and Simulation. And it is the buzz. So Tampa Bay is becoming where tomorrow's healthcare happens today. And we think we're leading that revolution.
So what does it do?
So here's the example. I'm a surgeon. The last time anyone checked my technical competence was 1984. Okay, I hope none of my patients are listening. But that's true of any doctor in this country. I'm also a private pilot. Every year I have to get my technical competence checked. So the first thing that we're doing is we want to make sure that anyone that performs surgery really is competent. The other thing we want to know is that residents aren't practicing on patients, that they're practicing on simulators until they're competent. But the real excitement is what Laura does in getting doctors and nurses to work together.
And I want to talk about that, because you really talk about helping doctors communicate with their patients, communicate with other medical staff, and to where it's more of a personalized approach to medicine. But I want to have you, Dr. Klasko, take us inside Camls, because I've heard all about, they've got scenarios, you've got mannequins with real heartbeats and all. Tell me about the mannequins, first of all.
So we're the largest freestanding simulation center in the world.
Really?
Yeah, I know that because we were going to be 85,000 square feet. We went to the largest one, which was 87,000, so we decided to add 5,000 square feet. Yeah, it's but,
quite competitive, aren't you?
Well, I come from South Philadelphia, and you know how those folks are. But
I want mine to be bigger.
But when you walk in there, so I mean, I'll give you just a couple examples. We have a Department of Defense grant where you will see an injured veteran, and if you walked in there, you go, this person is an injured veteran. He's got his leg partly cut off, blood is spurting. But not only that, we actually have the whole background is desert lighting and out of a MASH unit in Kandahar. So let's say you take reservists that have been in Connecticut operating in a private hospital. Now they're going to go out to Afghanistan. They can practice the actual surgery they're going to be doing. They haven't done that for a while, but they can do it in the environment that they're going to have in Afghanistan with helicopters going overhead. So when you look at this, you would think you walked into Afghanistan. It's the only place in the world that can create that kind of lifelike piece. We're working with a company out of the Netherlands called Philips, which is creating that ambient lighting. So that's one.
And so what is the mannequin? How lifelike is that?
It's incredibly lifelike, and when we do our things, people are dressed in the gown, they're sterilized. Everything at Camls is real patient grade. So we're operating on that mannequin.
And so if the mannequin dies, then they practice on a mannequin, and they haven't lost their patient.
Right, exactly. Yeah. Well, they have lost their simulated patient, but they haven't lost the real patient.
Real person.
And the cool thing is every room is almost like Monday Night Football, because then people are recording it and then going over what happened. Not just happened technically, but let's say there's a frustrating part of the case, and the surgeon gets angry and throws an instrument at the nurse, which has been known to happen. We can then debrief them and say there might have been a more constructive way of handling it. But it really gets them, just like you look at your golf swing or tennis swing, to look at how they handled both the technical piece and the teamwork piece. And there's no place in the world that's as complete as that. And that's why companies are excited about it, accrediting bodies are excited about it, hospital systems are excited about it, insurers are excited about it.
I think you're excited about it.
I'm pretty excited about it.
Dr. Habner, when people walk into Camls, what do you think will amaze them the most about the facility?
I think the realism of it, and that's a big part of the education and the training that we're imparting, because we spoke about the mannequins and what they can do. But the mannequins themselves in a classroom or a conference room really don't bring things to life. It's the surroundings, the equipment, like Dr. Klasko talked about. If that equipment is real, then they're starting to suspend disbelief and we start seeing what they do in their real clinical environment, and then their behavioral traits, which, as we talked about, is one of my focuses, really come out, and we can really work on those skills.
And what skills are you talking about?
Well, we usually break skills down into knowledge, and we take care of those in a lot of multiple choice tests, and that's really the biggest thing we do right now in healthcare is rate everybody based on whether they pass a test or not.
They pass a test. They
Right.
have the
we have those
information. They have knowledge.
competencies,
Okay.
you know, and that's validated.
But what
then
else
there's
is
also
important?
technical skills and behavioral skills. And when I talk about behavioral skills, I'm really meaning the teamwork and communication skills. So you might know and can spit out the whole algorithm for a resuscitation and bringing somebody who's back to life or bringing their heart rate back. But you have to be able to apply that. And you can't do that alone. You need to do it with the help of your nurses and your respiratory therapists, and you have to work as a team. And where we really see a lot of errors in medicine is when that team communication breaks down. And that's well known. Other high stakes industries have seen the same thing. It's because we're humans. We're really talking about human factors. And we have this great lab in Camls, essentially. The whole place is a lab that we can study these human factors and study these practicing healthcare providers.
You know, I think I've read studies that said patients where mistakes are made or get the outcomes that they don't desire, if the doctor just simply says, you know, I'm really sorry this happened,
that's
that they're much less likely to say, I'm going to sue that place. They say, you know what, this doctor, this nurse, this whatever, cares about me as a person. And that's something that you guys are working on, right?
Absolutely. I mean, this
Exactly.
is part of a whole transformation of USF Health. We're creating the future of doctors. So let me give you an example. We're the first medical school in the country that has a program where we're choosing docs based on emotional intelligence. Think about
Emotional
it. Emotional
intelligence.
intelligence, self-awareness, empathy, the kind of things you talked about. So think about this for a minute. In 2012, we still accept students based on their science GPA, their MedCats, which is a multiple choice test, and organic chemistry memorization. And somehow we're amazed that doctors are more empathetic, communicative, and creative. It's why we went from Marcus Welby to House in how people view us. So what we're doing is we've started a medical school with a hospital in Pennsylvania, 2 years in Florida, 2 years in Pennsylvania, where we erase the objective criteria and choose them based on emotional intelligence. We're working with the aviation industry because they view that in pilots. We're working with a company out of Wharton that's objectifying emotional intelligence. So you take that from changing the DNA of healthcare at the student level, and then the things that Laura is doing for those of us who are already doctors, and then exactly what you talked about, the ability to apologize, the ability to look at the patient as a partner and somebody you're working with instead of I'm the captain of the ship, totally changes. We believe we'll have less malpractice insurance cases.
Absolutely.
We believe this is transformation. Everything this week has been about reform, Governor Romney, President Obama. We don't worry about the politics. We're transforming healthcare here at USF Health.
So you're basically taking research and applying it to the term that people grew up with, which is bedside manner.
Yes.
Does this person have bedside manner or not? And so you're really taking a look at that now
Yeah,
and saying
and-
this actually has more value than we thought.
Exactly. As you said, those studies are true, that if you can apologize or disclose an error properly, you earn the patient's trust and they're much less likely to sue. But we want to see a transparency in medicine that we haven't seen in the past because of a lot of the medical legal implications for one reason, and also the idea that people were afraid to admit they could make mistakes, and we need to change those thought processes. So we can do that at Camls by using standardized patients or actor patients. And
Actor patients?
Yeah, we have the healthcare providers work with the actor patients in a scenario where they have to either give them some really bad news or tell them that there was their meds were dosed incorrectly or something along those lines. Yeah. And then where the real learning happens for the learners who went through that is we go and debrief them. We're videotaping that, like Dr. Klasko referred
Really?
to the Monday night football, and then we can play Monday morning quarterback. But we really don't do it in a critical way. In fact, the learners usually are more critical of themselves than we can be, but we facilitate that discussion either with the individual or with the team in our team scenarios about how we could have handled this better. And that's how adults learn. They're really reflective of their own behaviors, and they learn through active learning as opposed to sitting.
So there's no class in medical school for this,
No,
right?
and even the name
Right.
USF Health, one of the cool things, Kathy, you come to my campus and you talk to a nursing student, a pharmacy student, a public health student, a medical student, a physical therapy student. Where do you go to school? USF Health. There's no other health science center like that, and the president was smart enough to put a single college of health for all intents and purposes. So here's the way to look at it. In most places, the nursing students and the medical students never learn together. And then we throw them into a difficult operating room, and we're amazed that we don't function as high-powered teams. It'd be like if the Orlando Magic all practiced at different gyms and just got together for the playoffs. So what we've done at USF Health is create this interprofessional model where basically each of those folks feel like they're part of the team from the very beginning, before they have a chance to get arrogant or change the way that they view things.
What is the impact on the Tampa Bay's economy?
It's going to be huge, and it's going to be huge in three different areas. First, just because Camls will bring 30,000 docs a year to Tampa Bay.
They're coming here.
They're coming here to learn. So, and new procedures. So there's something called hybrid OR, which is a new way of removing valves without making an incision. You can remove somebody's heart valve now without making an incision. It's very futuristic, believe it or not.
Hologram.
The company, which is Philips, that makes the hybrid OR, has said any place in the world that buys one of our hybrid ORs, as part of the price, they will come to Tampa with their cardiologists and cardiovascular surgeons and radiologists to train.
So they'll come right here.
So
they all have to pass through Tampa,
exactly.
Florida.
They're going to be right there downtown. And the cool thing about it is, so we've been open 3 months, and you know how startup companies are. We've already been responsible 3 months for 7,000 room nights in Tampa, and another $500,000 of auxiliary economic development.
Wow.
So you multiply that by, next year we'll double and triple. But not only that, it's starting this process where people are saying, boy, healthcare, the futuristic part of healthcare is really happening today. They're going to be the iPads of healthcare. So there's an Israeli company, a simulation company that has their headquarters in Cleveland because of the Cleveland Clinic. They said, well, actually, Tampa Bay is actually cooler because of Camls. We'll move from Cleveland to Tampa Bay. So we think it's going to have huge, huge, huge repercussions. We've talked to the Economic Development Council about branding Tampa Bay as where tomorrow's healthcare happens today.
So you mentioned in the green room that there were ambassadors coming through. Who's
Yes.
coming and why?
We had 70 countries' ambassadors as part of the Republican Diplomatic Partnership. And it was really exciting. Laura got a chance to give tours, and all of them, we're putting in that we have to talk to our university and get them down here. In fact, the ambassador from the Netherlands called over the ambassador from Sweden, and he said, you got to get these guys a Nobel Prize. And the guy said, well, it's a little more complicated than that, but thank you for your suggestion.
So what we're really talking about in terms of not only this, but this whole move toward more personalized health care, right?
Yes.
How do you see USF Health fitting into that?
Well, I'll start, and then maybe, I think that personalized healthcare really has a few components. One is we want to treat every person as an individual. That's what Laura gets into.
You don't want to feel like you're a
patient
number.
comes first.
Right,
You want to feel like your doctor or healthcare
So,
person.
right. So, for example, our infertility group is the only university infertility group around that actually takes care of each patient by themselves. You're not seeing somebody underneath them. So they have all the best of the university with the best of that kind of personal care. So that's one piece of personalized medicine. We're also excelling in a second piece, which is using your genetics and your genomics to help you make decisions. So here's the story. Right now, if you're on a cholesterol-lowering drug, somebody looks at somebody my age and says, for a 57-year-old that has this cholesterol, let's put you on 20 milligrams of Lipitor. We brought in the top guy in the country from the University of Maryland who's looking at your genes and saying, based on your genes, you should be on exactly this dose, or you shouldn't be on Lipitor at all because it won't work. So our chief of cardiovascular sciences, who came from Georgetown, did the seminal work on African-American folks, did not do as well on the medications we use for congestive heart failure. We just couldn't figure it out. Were they not taking it? It turns out there's a genetic combination that's in 80% of of the African-American folks, but only 20% of Caucasians.
Wow.
And so we were able to come up with a different combination. So personalized care, I know you talked to the Moffitt folks that are doing that in cancer.
Right.
We are leading the country in heart. And in fact, the county has given us $2 million to create a database with the American College of Cardiology. We'll be the first in the country to do that. And the state has given us money to start building what will be a personalized medicine heart institute, using your genes to keep you well from a heart point of view.
Is it expensive, this gene testing? I mean, it seems like something that is going to be expensive at first and then may become more affordable down the line.
No, it's actually pretty inexpensive now.
If you listen to people talk about mapping the human genome,
Right.
what the time that took and the money that
Yes,
took back then
huge.
versus now, because of the advancement of technology, the price has come down considerably.
But here's the issue. The problem is in the past, we've had the academic viewpoint, which is we're not going to market this till, the science is 100% right. And then you have the entrepreneurial viewpoint, which was, hey, I'm going to market it right away. So there's a company out there, 23andMe. You can take your saliva at Walgreens, send it out, and you'll get your genome. It's only $259. The problem
Really?
is you're not getting the advice after that. So we call ourselves, my background is I'm an OBGYN with a Wharton MBA and I have both sides of my brain. We call ourselves the first entrepreneurial academic personalized medicine center because we're doing both. We're creating products that we can use with the backing of the university. So if you take that piece and then you take what Laura's doing around making sure that every one of our doctors treats people as a person, then we'll truly be a fully baked personalized medicine center. But the hard thing is going to be something that's going to bring a whole new level of economic development to
Right.
Tampa Bay.
So do you think we're looking in the future to, you talk about gene markers for cancer, heart disease, and things like that. I'm wondering if you think in the future we might be able to look at some things that we now see as like addictions and behavioral issues and character things. Will there be a genetic component to that once we are able to see what the gene structure is about how our brain works as well?
Well, I think that's a great question. I worry about that because I don't want to take away the personal responsibility thing. I think there might be some genes that affect your ability to be a more addictive personality. But I think that even if we find that, there's going to be ways of combating that. We don't want to get to the point where we say, well, gosh, nothing you can do about that. But I think we'll find more and more out about genomes. And Laura's a neonatologist, and the really beautiful thing will be starting to understand even better than we do now what combination of chromosomes might create congenital anomalies or congenital problems.
Right. But a big point here is that you need to know what you're going to do with the information you get. So I think that's kind of where you're driving at when you talk about the company that can tell you your genes with a saliva test.
Right.
But if you find out that you've got some lethal diagnosis, then you have no counseling to deal with that.
Here's the issue. If you find out you have a 6 times increased risk, God forbid, of having multiple sclerosis.
And that's what this test
what you
will
get
tell you?
back for $259.
Well, if we eventually map,
Yeah.
like you suggest, we
Yeah.
could map all
Yes.
of
Right.
these genes, we could learn all that information. We only want to know it if we can do something about it.
Right, so the reason our Heart Institute is so exciting because we're bringing the best of research with Dr. Liggett and from Maryland and Dr. Miller from Georgetown. We're working with Pepin and the entire Pepin family, as well as the Pepin Heart Hospital, to look at ways that we can make sure that there's science and counseling behind everything we do in the Heart Institute.
So, Dr. Habner, what are you seeing as like your sort of grand moments I know it's only been open a few months,
Right.
but as you take people through some of these behavioral strategies, what are you seeing that they're realizing?
Well, what we call it when they have that moment is their
Their
aha
aha
moment.
moment, right, right.
You go through a
And
scenario.
for doctors, that's
Yeah,
a big deal.
sure.
Which may be something they've done many times, gone to a preterm delivery, to take my specialty,
right.
and resuscitated a baby that with a group, and then they realize, because now they can view what they did on video, wow, is that how I always approach that? It's a lot, people can become so much more insightful. We're helping them make those reflections about their activities and change, their behaviors. And that's really huge because we all need to be reflective about what we do and think about how we can improve. And in medicine especially, we want this lifelong learning.
So
to
in the
go
heat
on.
of the moment, to go to your specialty, you've delivered a preterm baby. I guess on the doctor and the nurses and all the tech minds is get the baby up and running or to the NICU or whatever, and maybe left behind is, oh my gosh, there's that woman lying there
Exactly.
who's just dying to know what her baby is doing. And so that can sometimes get lost, I suppose, and you're saying it's
Absolutely.
sort of a recognition of, oh my goodness, I could have gone over, and is that
Yeah,
what
that's
you're
exactly it. So for instance, if we could have that same scenario you just described, and I may be training more junior people, And they really need to focus right now on those skills to stabilize the baby, like you say, get it up and going. But I might have a more senior trainee that needs to start, they've got the other skills down, they need to start working on their interpersonal skills and recognizing that family's there.
Right.
And so in that scenario, I take the same scenario but interject an actor, mother, who is yelling, what's wrong with my baby, what's putting that pressure
Right,
on them.
right.
I've been in those situations, that
Yes.
happens in real life. And then it's there, rather than them feeling really badly about having that situation in a real setting with a real patient and mother, and letting the family down, they can practice those skills there.
Right.
Kathy, I intubated my first premature baby as an OBGYN resident in a chaotic delivery room with, hey, Klasko, this baby's premature, why don't you intubate the baby? Now that's wrong on so many levels, because first of all, they hadn't talked to the patient. Secondly, it's a very difficult technical experience.
And
So to
tiny,
go,
tiny
yeah, so and to
baby.
do it you have to get right in the
Yes.
trachea. So to go through that and have Laura, who is very non-judgmental, debrief you and say, first of all, look, think about how the patient felt. But
So
second of all,
she's critiquing
yeah,
you.
yeah, well, yeah. So I mean, but
In that case.
yeah,
In
in
that
that case, but that's what's so special about it. It's both the technical piece and the teamwork piece. So now you're going to be modeling behavior, and the aha moments for a lot of the docs, especially, is, well, I was sort of a jerk there, wasn't I? And I
Right.
mean, whether they say it out loud or say it to their husbands or wives,
Yeah.
at the end of the
The
day.
realization, yeah.
And I may not even have to critique, because he's seen it done well so many times, and once he sees himself do it, he says, "Ooh, that's not right." So that's
We're
where
talking about theoretically. That's
Right,
not me.
theoretically. So is neonatology represented in the simulation
It
center?
is, it is. Well,
So what are they able to practice in that arena?
Well, our standard resuscitation certification program, it's not really a certificate, but that we have to keep people's skills up in. It's like a CPR, when you go and take a CPR course. They have that specifically for neonatal resuscitation. It needs to be done every 2 years by every person that deals with a baby at Tampa General, for instance. They come through and have all their training done, in that course done, all hands-on, all in the simulated environment, all adding the teamwork learning perspective to it, and putting that on top of what is already a standard curriculum.
So you've
that's
got
an example.
neonatology, you've got the Iraq vet, I'm assuming
We have
that's for trauma.
Yeah,
So
we
what
have
other areas are?
cardiology.
Cardiology.
We have a large operating room where we can do anything. Neurosurgery. We had a situation with 30 neurosurgeons from around the world doing this new microvascular procedure on heads. Obviously not human, but literally.
Mannequin heads.
Yeah, literally at a time that somebody was doing it on a patient. And then we're giving them both the skills and the evaluative techniques to see how they handle that. So we have that. We also have this thing called procedure rehearsal studios, where you can take the patient's CAT scan and actually do the exact procedure you're going to do tomorrow based on that exact patient, so you can practice different approaches before you actually do it. Again, very similar to aviation. What happens
Right.
in aviation is if you
Right.
know the runway's been changed or the weather's going to be a certain way, you can put that in and practice that flight tomorrow before you do it. Again, we're the first place in the country that's able to do that.
Now, you have the ability then to have a physician in a remote location, somebody in Asia or India or Great Britain,
Right.
and interact through the satellite
satellite, yes,
capability
yes.
with what's going on
Yep.
in Camls.
Yes. But maybe the biggest issue, Kathy, is this. My passion for this started, I was one of the first doctors that did what's called laparoscopic hysterectomies in the 80s, where we didn't have to make incisions.
right.
So it then gets broadcast on Discovery Channel. And now every patient wants one of those new procedures, but let's say they're in a small town. Well, one of the things about docs, we never say, I can't do it, or go see that doctor. So they either say, well, no, that's not a good procedure, or they say, well, give me a little, I'll do it in a few weeks. Then they went out to the Caribbean, learned how to do laparoscopies on chicken models or whatever. And then we had more problems with hysterectomies during that period of time. So think about it this way. We take 20 years to get a new drug here in this country because we don't want anybody harmed. We take 10 years to get a new medical device through for the same reason. But once that gets through, anybody can use it. So what Camls is revolutionizing, let's say robotic surgery. See all those billboards in Tampa and St. Petersburg? We have a robotic surgery,
Right.
so you're safer. Well, that could be true, but not one of those hospital CEOs knows for sure that the person behind the robot is competent.
Has been trained
We've created
adequately.
a competency-based standard for robotic surgery. So what's happening, insurers are excited about it, malpractice folks are excited about it, hospital systems, large hospital systems are excited about it. So
And
for the
patients
first
should be
time,
excited about it.
you'll be able to
And
go
patients,
and say,
right.
you know, if you need robotic surgery, did you go to Camls? And we're going to have billboards, you know, is your surgeon practice safe surgery? You know, really that's going to be our billboard.
Well, to have the largest simulation center in the world here,
Yep.
I mean, it's just a huge, huge crown jewel for the Bay Area.
It is, and we're actually looking at building our second one in Panama. We've gotten, yes, the president of Panama has asked us to do a feasibility analysis of building USF Health Camls in Panama. It'll be an Intel Inside model, so it'll be called the Panama Center for Advanced Medical Learning and Simulation, powered by USF Health Camls.
Wow.
So we'll
That's
be all over the
terrific,
place.
just terrific. All right, Dr. Lori Habner, thank you so much for joining us. Dr.
pleasure.
Stephen Klasko, talk about Camls. Big buzz about this thing downtown, so really, really glad to hear more about it so I can understand. People talking about it. Good deal.
Thank you,
you.
Kathy. It
Thanks
was a
for
lot of
being
fun.
on
Thank
Front
you.
Tampa Bay. Coming up next is Florida's high-tech corridor on the path to becoming maybe the next Silicon Valley.